And our next guest served as the CDC's chief medical officer until she resigned in August. Dr. Deborah Howry is with us now. Doctor, so much to talk about with you. Thank you for taking the time with us today. You testified before the Senate this week about the chaos at the CDC under Secretary Kennedy. But I want to start with the vaccine panel meeting. What's your reaction to what's unfolded so far?
Well, I heard the discussion y'all had, and I agree in general. I think my concern, though, is we want to give parents choice. And the vote they just did on the measles, mumps, rubella, and varicella combined vaccine takes away that choice. Only about 15% of parents were doing that combined shot under age 4. But now we've told them that parents don't have the right to make that decision. And I think what concerns me going into today's discussion is the COVID vaccine recommendation language still hasn't been posted. And just seeing what confusion the members of the committee had yesterday when voting on things, if they don't even have the language decided on yet. The public can't weigh in, and I'm curious to see how the members will decide how to vote.
Are you heartened that some members of this panel really did push back and stand up for the science?
I am heartened. I just wish all of them, would really take a step back objectively and decide, why were we deciding some of these vaccines like MMRV and hepatitis B? I really appreciated a lot of the clinical organizations asking that exact question. If there isn't significant new data or safety issues, follow the usual process, involve work groups, the grade where you look at the quality of science and the evidence to recommendation framework to look at, implementation and equity. Those are the things that need to be considered if there's not an urgent issue. And by having them on the agenda yesterday, I was surprised that they were revisiting things without significant reason to do so.
The panel is also expected to vote today on making changes to the COVID recommendations.
Yes.
You talked earlier this week about how your mom, who wanted a COVID vaccine, couldn't get one. What's your message for people who can't get those vaccines right now? What should they do?
I think one, if you need a prescription, call your doctor, see if they can call it into the pharmacy, go to your primary care doctor. And this is when it gets into really time and access. My mom was able to get a shot by finding a third pharmacy. I called today to get a shot for myself and was told I need a prescription here in Georgia. And so everybody's going to have to navigate this. And that's not what we want. We want people who need a vaccine and want a vaccine to be able to get one. And it appears there are really a lot of differences by chain, by state. And that's going to make it difficult for people to protect themselves.
Right. A lot of people are confused right now. What's your advice to those parents who, just are trying to understand the sudden changes and maybe they're concerned about their insurance coverage?
Well, and yesterday's discussion was interesting at the committee meeting because they initially voted to have vaccines for children cover the combination vaccine, even they recommended against giving it under age 4, which was a disconnect. And then this morning, they voted to undo their vote. And so now there's essentially no coverage for vaccines for children for that one vaccine for the MMRV under age 4. Usually the schedule insurance companies will cover. When you have these changes, we're going to see differences in coverage. Right now, flu was covered or is covered. COVID vaccine, it'll determine on what the recommendation today is. And if insurance companies will then cover it based on what the recommendation is.
Dr. Howry, during Wednesday's hearing, you talked about a culture of fear and hesitancy now among CDC doctors and researchers, especially after the shooting at your offices in August. Here's part of what you said about your former staff.
I have many that won't speak about vaccines now and have removed their names off of papers. They don't wish to present publicly anymore because they feel they were personally targeted because of misinformation.
If people are too afraid to stand up for their work, for science, where does that lead?
We're even seeing that in today's meeting and yesterday's meeting. They had a subject matter expert room to where if the leader who was presenting on the science didn't know some of the detailed questions, they had to turn to the subject matter expert room to really provide some of that space and anonymity for the scientists. Not a great place to be. You want scientists to be able to have those discussions with the public and to engage. But at this point, given how polarizing vaccines have become, particularly with the misinformation that continues to be spread, many of our scientists are feeling very targeted.
Senator Cassidy has invited Secretary Kennedy to testify again about the concerns that you and other former CD officials have raised, especially after the hearing on Wednesday. You've called for his resignation. What questions would you like to see him have to answer?
I would really like to see, where is he getting his information from? His briefings when it comes to CDC topics like measles, flu, vaccines, because it hasn't been from senior career scientists. I would like to understand, why some of the scientific, presentations were taken down off the CDC website. If we believe in radical transparency, as I do, we should want to publish all the data and scientific papers and allow the public to make their decisions. And so those are some of the questions I want to hear. And also, what is he doing to make America healthy again? We've heard a lot of the MAHA work, and certainly safer food and water is important. But we need to have him promoting vaccines and not vaccine misinformation, as he has been doing.
Well, maybe some of those senators are watching right now and will channel your questions into whatever hearing comes to fruition following your testimony. Thank you so much, Dr. Deborah Howry, for joining us.